Europe is grappling with a second wave of COVID-19 infections. Governments are racing to impose tighter restrictions, but the question is it too late? Two of Europe's biggest capitals are currently in trouble, with Paris imposing overnight curfews and London considering banning people from meeting indoors to combat the spread of the virus. The World Health Organization's European office has now said that the rising surge in cases causes great concern.
Fall-winter surge continues to unfold in Europe with exponential increases in daily cases and matching percentage increases in daily deaths. The evolving epidemiological situation in Europe raises great concern.
French President Emmanuel Macron announced that 9 regions, including Paris, will have a curfew starting from Saturday. The curfew will impact 18 million French citizens. The state of health emergency for the country has also been reinstated. Residents of these 9 cities would not be allowed to be outdoors between 9 p.m. and 6 a.m. from Saturday for a duration of at least 4 weeks. The new measures are to stop people visiting restaurants and private homes in late evening and night. London will enter a tighter COVID-19 lockdown from midnight on Friday as Prime Minister Boris Johnson seeks to tackle a swiftly accelerating second coronavirus wave. But anger is slowly rising in the city over the economic, social and health costs of the biggest curtailment of freedom for decades.
We must take firm and balanced decisions to keep this virus under control. This is the only way to protect lives and livelihoods. And we must act now. Delayed action means more deaths from COVID, it means more non-COVID deaths, and it means more economic pain later, because the virus comes down slower than it goes up. We should stop it going up in the first place. And unless we suppress the virus, we cannot return to the economy we've had. Unless we suppress the virus, we cannot keep non-COVID NHS services going. And unless we suppress the virus, we cannot keep the elderly and the vulnerable safe and secure.
In Spain, the health minister said that the coronavirus situation was very worrying, with coronavirus patients occupying 20% of hospitals' capacity in Madrid. Since Spain exited a tough lockdown in June, the infection rate has soared, with daily cases exceeding 10,000 from late August. Hospitalizations are on the increase too, but the number of severe cases remains far lower than during the first wave. Now moving to Germany, Chancellor Angela Merkel has said that she and leaders of Germany's 16 states have agreed on tougher measures. Limits will be imposed on the number of people at private events if an area records more than 35 new infections per 100,000 people for over 7 days. Even more stringent caps will be enforced if this number exceeds 50. Europe's biggest economy will also begin imposing mandatory face mask wearing at crowded places. Netherlands, which got away with some of Europe's laxest regulations, is also going to impose a semi-lockdown. Its strictest measures since March. All pubs and restaurants have been ordered shut, but unlike the first lockdown, schools and public transport will operate. The measures will last for 4 weeks, with a review scheduled after 2 weeks. The Netherlands has the highest per capita infection rate anywhere in the world, reporting a daily caseload of over 7,000. However, even as cases are rising across Europe, countries have gone for targeted restrictions rather than imposing nationwide lockdowns for now in this phase.